Quebec has just been the worst of all the provinces because we've invested the least in terms of people.
More than 1 in 4 Quebecers don't have a family doctor. That's according to the province's Institute of Statistics. ISQ research found that the number of Quebec patients that do has dropped from 82% in 2019 to 73.3% in 2023. The decline is in part connected to a wave of family doctors that have retired, leaving patients to be cared for by a group of doctors through the guichet d'accès à la première ligne. But health experts say this approach may not be suited well for all long term.
There is a lack of access. And this lack of access, we're trying to compensate for it through the guichet, which does pay doctors who have holes in their schedule to take on an extra patient. But it's not a long-term solution because that's only for the moment. The average physician age in Quebec is about 60. So doctors are retiring. The proportion of new doctors coming in is less versus the population, which has grown a lot.
According to the Quebec Health Ministry, the overall registration rate of the gap rose to 83.1% as of July 15th.
The problem is that we have too many generals at Quebec Santé deciding what to do when to try to manage the system better, when the real problem is lack of nurses, lack of physicians. So there's not enough soldiers on the ground.
Health experts say several thousand patients whose health concerns are deemed high priority currently have no choice but to be cared for by a mix of family physicians. But those with family doctors note the benefits of having the same care long term.
I kept the same family doctor for me and my children, my grandkids. They'll have the same family doctor. There's a benefit because they know a lot about you and they could treat you better.
They keep you dated with all the pills, everything you need. They make you pass the test. Very, very important.
The same doctor has like all the checkups that you did, your yearly checkups. They have like all the data on you. They don't need to go look for it.
I stopped looking after a short while, and then about a year ago, 2 years ago, someone phoned me. I am chronically ill, and I couldn't find a doctor, and I need one for this particular disease.
If you need to see a doctor, it's hard. If you have to go to the hospital, like in the emergency room, you have to wait like 12, 20 hours.
The long-term solution is that everybody has access to a family doctor who will follow them and be able to screen out for illnesses before they occur.
In Montreal, Anastasia Dextrene, City News.